Dr. Phumzile Mlambo-Ngcuka, thank you for the opportunity as always, and good to see you.
Good to see you too.
You participated in a virtual event this week to mark Africa Day. The theme, African Woman, You Are Unique. What was your message to the event in that regard?
Well, I celebrated African women for being resilient. I saluted African women health workers, like all the other health workers in the world, for keeping us safe and for shouldering the response to this pandemic. I also saluted and highlighted the fact that most African countries have economies which are largely informal, and women dominate in the informal sector in Africa. And it means that they are the ones who actually are the barrier between extreme poverty and a relatively survivable way of life. If you were to remove women in Africa, in most of the countries, no amount of commodities and any other economic activities that exist in most of our countries would be able to keep our nations in check. And they do all of that with very little return for themselves, with very little access to basic services such as water and sanitation, as we have seen in this pandemic. And whenever they are called to take action, as they have been called now by the Secretary General, to respond to the call of the global ceasefire, women in DRC went straight to the rebels to tell them, hey, Nina, put down those guns. And they face them in their faces. Women in Central African Republic have done just that. Wow. Women in Burundi have stood up and said, we want peace in this country and we're going to fight these elections. And they won in many numbers than we've ever seen before. Same in Mali.
So in many ways, women are at the forefront of this call for silencing the guns by 2020. I mean, this deadline is beckoning.
Yes. And young women, too, are playing a critical role, from using technology to using the traditional way of organizing people.
And yet, Executive Director, in times of crisis, from conflicts, natural disasters, pandemics, you have the most profound effects on women and girls, who are historically society's most vulnerable. What are you seeing in terms of the role of women and the impacts on women during this pandemic globally?
Well, in addition to the fact that women are showing up to play their role, women also are highly exposed because there are so many of them who are working in the sector. 85% of them are nurses. More than 80 of them are in the other ancillary services in hospitals, such as cleaning and cooking. And the majority of health workers who have died from, the majority of health workers who have died are women. So women are dying from work more than, patients who are predominantly men who go into hospitals because of the disease. Women die because they are helping the patients to survive. Women also are at high risk of poverty and food insecurity, because their way of trading in many African countries especially is informal, and they're in the open air. In lockdown, you go in, you cannot be in open spaces, and that has affected them profoundly. They don't have savings, they are in unsecured jobs, and they are therefore able to enforce contracts in a time like this, not unless there's an orchestrated a way of addressing their needs from government and other stakeholders.
UN Women has said that the pandemic underscores, and I think this speaks to what you've just been talking about, underscores society's reliance on women, both on the front line and at the home, while simultaneously exposing the structural inequalities across every sphere, from health to the economy, security, and social protection. To what extent has this pandemic reversed some of those gains, those hard-fought gains that have been made on some of the core issues under your portfolio?
Firstly, I must underline that there is no pandemic that is gender neutral. Mm-hmm. And this pandemic is no different. Two of the gains I want to highlight that are at highest risk of being reversed. Girls' education, which, as you know, Sherwin, I talk about this all the time because it is so important, and we fought for girls' education in the last 25 years since Beijing, and profiling the needs of a girl child, fighting child marriage. If girls are not at school, we are at risk of increasing child marriage, trafficking of girls, and early pregnancies, and some girls would not go back to school. So I am quite concerned about that challenge. Secondly, maternal health. You know that in the last 20 years, one of the areas where we have seen some progress is in the area of decreasing maternal deaths.
Right.
With hospitals being full and other patients who are non-corona patients struggling to have access to hospitals, women giving birth are at risk of having to give birth to these conditions that in the last 20 years we have fought so hard to improve. Now, this is something, therefore, that we are constantly raising, and I'm glad to see in South Africa that the minister has been talking about the importance of not neglecting other health needs that society has. But for women, maternal health is one of those that is really in danger of being affected.
So you've mentioned girls' education, fighting child marriage, trafficking, maternal health. What about this one, Ed? I was looking through some of the data in terms of just the domestic violence, which shows an increase since the lockdown, 33% Singapore, 30% France, 25% Argentina, while we've also seen a massive spike in South Africa. It's fair to say that one pandemic has really exacerbated the other pandemic, not so?
Yes, absolutely. Men's violence against women is a shadow pandemic. We need to be talking about flattening the curve of coronavirus as well as the curve of gender-based violence, because violence against women will exist even after corona, which means we have to intensify the fight to end the violence against women and stay with the fight beyond coronavirus until we actually have reached a point where we have been able to tackle it. We have seen in some countries governments taking away the resources that were supposed to go to the fight against violence against women and taking it to address the needs that they have for addressing coronavirus, taking shelters that are meant for women who need to go to secured places and using them for isolation. And this is another area where we are reversing gains that were already made. We are actually calling for more resources to go to women, to women's shelters, to hotlines, to
as
NGOs.
Part of the COVID national plans, right?
As part of the national plan and beyond, because we want this to continue. It should have been there it has been, there's a violence that's been exacerbated under coronavirus, and the response must stay and help us beyond coronavirus. And we are seeing that in some of the countries, however, I must say, they have increased the resources for women. And we are also calling for countries to declare the services that women need to survive this violence essential services, so that women have a passage out of home to seek help, and those who are providing help have a passage into the home of a woman to assist the women. I have been calling all governments in the world.
Has South Africa's plan included some of the details you've just expressed?
Yeah, well, yes, the services that are for women are essential, but obviously we need more resources because the need is just so great.
Let me jump in here with another one. We often hear politicians and international civil servants talking about the need to build back better, build back smarter,
that
build back greener. People you know, yes, people you sit around a boardroom table with the executive director. What about women and girls? What should happen now moving forward as we begin to slowly emerge from restrictions and lockdowns around the world? We want to build back greener, but what do we want to do in terms of the women's rights movement?
Building back better means we're not going back to the status quo, to the old normal. We keep on talking about new normal now. New normal must be really new. It must not be the way we were pre-corona. So when we are talking, for instance, about violence against women that we were talking about, it must mean significant investment and intensification of the fights to end violence against women. It must mean that access to water and sanitation in schools, which affects girls so much, becomes something that is solved forever, because it's been an unfinished business since the MDGs. It also, building better also means digitalization and closing the digital divide in communities, but also between girls and boys, so that every child, wherever they are, is able to have access to virtual learning. It should not be an afterthought. It should not be an isolated intervention. It has to be universal access. And building back better, it means primary health care that works, so that people are able to get services closest to where they are, and they can have easy access to continuous support for their health needs. Midwives, to begin with, in communities, and of course, tertiary care as well.
Yeah, it's a broad spectrum. It's, needs a lot of resources, certainly. Let me ask you a final question, Executive Director. Several publications recently highlighted leaders who have done a good job in managing the response to this crisis. I'll mention a few of them. Prime Minister Jacinda Ardern of New Zealand, Germany's Angela Merkel, Finnish Prime Minister Sanna Marin, Denmark's Mette Frederiksen, Norway's Erna Stolberg, and Taiwan's President Tsai Ing-wen. What do those names tell us, and what's the lesson we should learn here?
Well, trust women. But I want to add also the Prime Minister of Namibia and the President of Ethiopia, two countries in Africa that are also managing the pandemic, and those two women are also in the leadership of those countries and leading the response of their countries. Women also tend to be focused on the issues, eyes on the ball. They are not distracted by politics, which have nothing to do with the response. They are actually quite good at mobilizing society to hold on together in a time of crisis. They are used to multitasking. I think they also have a good sense of what you do to have a family and a people-centered approach. Because when you're dealing with a health pandemic and people having to grapple with their mortality, this is something that affects families. And women know how to straddle between hardcore, dealing with policies, security, and also being very close to people and people's needs and understanding how they feel as mothers, as parents, as children. As you know, the Prime Minister of Norway even had a press conference for children just to help the children understand what this was all about, because children were scared and confused.
Well, I'll tell you, trusting women is a great way to end any discussion. Under Secretary General and Executive Director of UN Women, Dr. Phumzile Mlambo-Ngcuka, as always, thank you so much indeed.
Thank you so much.